Hi there, Dr. Jamie Mabius here. I'm a licensed chiropractor with a postgraduate certification in veterinary chiropractic, massage, and rehabilitation therapy. Today I'm going to show you a little clip on Nolly. She is an American Bulldog Pit Bull mix, and she is presenting with a little bit of back pain. So what we do is I assess the full spine because I want to ensure that the back pain is actually a result of back pain and not compensatory pain from somewhere else. So here you can see me checking her cervical range of motion. I checked both lateral flexion and move her into extension, and then forward flexion in between her front legs. Next, we're going to move into palpation of her spine, and the technique that we use is called motion palpation. Now what that does, it checks each vertebrae, makes sure that it's moving properly in accordance to the one in front and behind it. So what you can see here is that Nolly's spine is bouncing and moving pretty freely. But what can happen is if there's a restriction on that spine, that vertebrae is stuck and not moving as it should. So then we apply a chiropractic adjustment to that joint to get it moving back more properly. So here I'm checking her full spine. I checked the base of her neck, which tends to be another problem area for her. I'm also checking the tone of the muscles in all of her extremities. I want to be sure that everything is equal side to side. I then move into motion palpation of her extremities by moving her limbs into flexion and then pulling it out to extension, and then comparing to the opposite side. I then am also going to move into her front limbs as well, and we'll also be comparing side to side by bringing it up into flexion, checking that scapula, making sure it's not adhered to the muscle wall beneath it, and moving her into extension. I then need to compare side to side, but as you can tell, she's a little bit distracted, so I need to get her attention back so I can assess that limb properly. Next I'm going to move into a chiropractic adjustment. Now I assessed my areas of her spine and I know which areas are restricted for her, but I'm going to start up towards her neck first. I very rarely start in the most painful areas. I don't want to startle a dog and not be able to finish my treatment. So I work towards that area. So I'm going to neck, I applied a quick chiropractic adjustment, and then I reassess the area of her spine to ensure that it's moving properly as it should. I'm going to check her upper cervical spine to be sure that was moving appropriately. And then I'm going to move into her TMJ. Just like humans, animals can get TMJ issues as well. I am then going to move down to apply a chiropractic adjustment to her thoracolumbar junction. I'm going to do a quick impulse here. I'm going to reassess and apply one more, just a segment beneath it. Then I'm going to check one more time. Then I like to do just a little bit of rubbing of the muscles beneath it to make sure no muscles will spasm in that area. I am then going to move to assessing her SI joints, or her sacroiliac joints. That is where the pelvis meets the sacrum at the base of the spine. That joint also translates movement from the lower extremity forward, so it's good to ensure proper motion of those joints on both sides. So here I'm going to do a quick chiropractic adjustment to her left SI joint, and I'm going to double check and ensure that it's moving properly as it should. After I'm done adjusting her spine, I like to follow up with a little bit of tail traction if it's indicated. So for Nolly, what I'm going to do is I'm going to apply a little pressure just at the base of her tail, but I want to be sure that she's looking forward as I'll be distracting the joints of her spine. The ultimate goal is to not only affect the lumbar spine, but also the thoracic and the cervical spine. Next, we're going to move into a therapeutic laser treatment for Nolly's lumbar spine pain. Therapeutic laser is not only good for pain relief, but it helps to improve function of the area, reduce inflammation, and heal the tissue beneath the skin. Here, Nolly is not feeling any pain at all. The probe head might just be a little warm to her, but does not produce very much heat. It's a very soothing type of therapy. For this particular therapy that we're providing, it is a point-to-point. So we're going to be holding the laser in particular points for a certain amount of time and moving on to the next place. Now we're going to follow up her treatment with a little bit of core exercise. Now, depending on the dog and how severe their low back pain, I may not introduce this right away. It's going to be dependent on the animal. But Nolly is healing quite well, so we're going to work on some stability exercises to help support her core and hopefully reduce the incidence of recurring low back pain. So we're here, I'm having her work on a stability disc, just trying to challenge her core in a couple different directions. I'm going to have her do some circles on the stability disc, have her do some sits, try to encourage her to lean forward and backwards. Before trying these exercises, please consult with your veterinarian to ensure that your animal is ready for these types of exercises. Then to finish our treatment, we're going to give the owner some home recommendations. For Nolly, what I'm going to be doing is I want to do some back extensions. So I'm going to explain to the owner that I want Nolly to maintain a sit on the ground, and the owner is going to maintain that sit by holding their pelvis. Then with using a treat with their opposite hand, we're going to have the dog reach forward to try to get that treat. To learn more about the treatments that you've seen in today's video, please visit us online at www.chiropractorforanimals.com.